Over
Yes.
to you.
Thank you, Dr.
Good
Nudan
evening.
Sahani sir. Good evening, good afternoon, and good morning. This is the 1966th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Manasvi Manish Nikam. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share the same with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. And we are very happy to begin the session today. Today we have a wonderful guest in from Pune. That is Dr. Dr. Manasvi Manish Nikam, and she is a BHMS and then MD, E.M.S, and Diploma in Psychology. And she is a consultant homeopath as well as the Deputy Director, Aditya Homeopathy Hospital Healing Center, Pune. As you all know that this hospital has a peculiarity. This is one of the hospital where we have more than 100 beds for the treating acute as well as chronic patients, and it is run by one homeopathic legend named Dr. Amar Singh Nikam, and Dr. Manasvi Manish Nikam is the uh, daughter-in-law of Dr. Uh, Amar Singh Nikam sir, and she is a wonderful person who has who is doing lot of work for homeopathy. She is running a lot of primary health promotion process like medical camps as well as medical awareness camps, etc. She loves to practice in chronic and autoimmune diseases, women's health, child development, and emotional wellness. Actively involved in social initiatives, and she has presented a paper in Germany. That means that she is an international faculty, and she has done a lot of work for homeopathy, particularly for children's health. And today, Doctor will be talking about managing complex diseases with a simple homeopathic medicine. As you know, Dr. Nikam always practices with single remedy, and he is a specialist in practicing 30th potency. That I know he has done a 2-day session in Kerala some 20 years back, and that was the first time we have a 2-day session in Kerala with more than nearly 600 participants from Kerala. And I have a very wonderful relationship with our this Amar Singh sir, and we proudly salute to sir and welcome Dr. Manasvi Manish Nikam to this session. Yes, doctor, you can begin the session.
Thank you. Thank you for such a warm welcome. Am I audible, sir? Danish, sir? Am I
Yes,
audible?
yes, you are
Yes, sir.
audible and
Yes.
visible. You can share
Yes.
also.
Yes. Thank you for such a warm welcome. And firstly, for arranging interactive and sharing session with IFPH. And I'm very delightful to share little of my insights of homeopathy through the discussions on this topic today. Uh, I would like to have this session very interactive. As you heard my introduction, uh, I practice in Pune, Pimpri, under the guidance of legendary homeopath Dr. Manasvi Nikam. So I'll be sharing a case and some details about the case and discussion according to the classical homeopathy descriptions in organon of medicines. So firstly, I'd like to show a short video of how we work for each and every homeopath who we have gathered together here. We also work in this field and we promote homeopathy in each and every possible way. So, I would like to show a short insight of what work we do through a small video clip, just for the purpose of motivation or just for the sake of my introduction. So, I'll share one short video. Is this video visible?
You have not yet uploaded. You can restart uploading the video.
So this video is visible?
And no, you must stop screen sharing and restart.
Yeah. I'll start the screen sharing.
That hearkened a new era in healing. The rays of the morning sun bathed his endeavor in glowing sunshine.
Everything fine. You can go ahead.
The hospital Ode Sapere, dare to be wise. One man dared to be wise. He began an endeavor that hearkened a new era in healing. The rays of the morning sun bathed his endeavor in glowing sunshine. This hospital you see here was not built in a day. It took one very determined man, 4 decades of absolute dedication and intense medical prowess. He is a man on a mission. He is Dr. Manasvi Nikam. Dr. Manasvi has spent his early years researching and practicing the classical form of homeopathy in the neighboring villages of Pimpri. But what prompted this man to build such an institution?
Actually, when I completed my college, I was not happy with the homeopathic consulting practice. At that time, I feel people are suffering very badly. They go for surgery, they go for expensive medicine, bypasses, so many critical surgeries. And the expenditure was very aggressive. So I understood the pain of society.
He shared his dream of building Asia's first private homeopathic hospital with his father. With his support and the courage to face every challenge, Dr. Nikam started a 4-bedded hospital in Pimpri on the fateful day of 2nd May 1995. This was the old hospital building which grew steadily. And now the new hospital is the fruit of his tireless work over 2 decades, dedicating his life to homeopathy. Let's take a look at this 7-story building. Separate general wards for male and female patients on the 2nd floor of the hospital. It also has 2 separate state-of-the-art ICUs. All of these services are provided at affordable rates compared to any other private hospital. From 3rd to 5th floor, there are semi-special and special rooms. Semi-special rooms have 3 to 5 beds, while special rooms have 2. The hospital also provides deluxe rooms on the 6th floor. These rooms feel different. There is no astringent smell of medications, no needles or IV bags, just the serenity of healing. The Aditya Homeopathic Hospital and Healing Center is a shrine to the science of classical homeopathy developed by Dr. Henneman. It has already revolutionized healing in homeopathy, and Dr. Nikam has taken the science to new heights. Healing, research and education converge upon this very establishment. The sun has risen for Dr. Nikam and his team. It is now shining its light, not just across India, but across the globe.
Yes, this was the short introduction. So I would like this session to be very interactive. As you can see the topic is managing complex diseases with single simple homeopathic remedies. So to introduce on this topic is that almost my fellow colleagues, you must be knowing when we are practicing, most of the patients which approach us or most of the patients which we see mostly come after many of treatments or many of other trial and errors of the medicines, and lastly they approach for the homeopathy. So when they approach for the homeopathy, the state of body at that time is very complicated and complex, as we say here. So, Dr. Hahnemann, in Organon also, he's mentioned that this complex of diseases or this complex of symptoms in this human body or patient that may be in natural form or they also may be in the artificial form. So when we talk about this at hospital practice, so now just we shared a short video that was just for the purpose that homeopathy at level of hospital practice is quite different word I use, because here we hospitalize patients and the target period of giving result is also quite quick. So to have thorough understanding of classical homeopathy and confidence over this is a very important key. So here, as we saw, this legendary homeopath, Dr. Amartya Nikam, who is my father-in-law. So I have been his student for years, and through his experiences and through his learnings, we learn to tackle such type of cases. So every case which approaches to a homeopath is always a different case. So every case which we see may require the different kind of approaches or the different kind of ways. Mm, when at hospital practice, what we had to do is we had to not leave the classical method, but we had to overcome these challenges also. So sometimes it's very difficult because the now form of the diseases or form of the miasmatic complexes, which we see are very, so it is very much challenging in such cases. So what we decide is not to leave our principles on which the homeopathy is based. So it is very a task or it is very difficult challenge to overcome such cases, not leaving the principles. Not leaving the principles, I mean to say in case that a single remedy. So principle means a single remedy. Then again the principle, again the word which means not leaving the rule that we have to practice only in minimum dose or minimum potencies. So we strictly follow these rules, and the thing is that we daily see results in complicated kidney failure diseases, organ failure diseases, and much more. So now, if we give the reference of organon of medicine for today's topic, So what Dr. Hahnemann at that time also he's mentioned that when two dissimilar natural diseases exist in the same individual, so two things can happen. Either one may suspend other, or both may coexist in a modified expressions. So what I recently what I told you was that most of the cases which approach us are mostly of these varieties nowadays. So I decided to share this topic today. So what are those? Either patient has come with many diseases together. Most of the Indian patients now, most of patients are known case hypertensive, known case diabetic, or known case of little but the fatty liver, or any other things. So there is always a coexisting some pathology and the presenting symptoms. So for some homeopaths who are not so clinically trained, there is always a dilemma to treat or confusion to treat with two different remedies, or to use some other different tonics, or maybe some formulas or etc. But what happens in this case, the disease presenting symptoms get more worse, because the materialistic doses of the formulas or tonic or specific medicines, what they do is they again mask the picture of original disease, or they mask the picture of real presentation of the patient. So in such case, patient may have relief for some time initially, but the patient will present with more worse situation in the future. So after seeing such cases, what has taught us is that if we go with the simple and classical method of studying characters, studying the totality, studying the presenting picture, being practical while taking the picture of patient. So this helps us for the permanent cure, the word which Dr. Hahnemann used, permanent cure. So the treatment in such cases should be that the homeopathic remedy that is selected, that should be very similar to the presenting picture of the disease, and that should able to create a stronger artificial disease. And in that case only we will be able to attain the perfect cure, what we say, the perfect cure, which follows the Hering's law, then again which follows the other expressions of what homeopathy philosophy believes in. So for this attainment of this kind of miraculous result, the thing which is important is to follow this rule. So today I'll be discussing this through a case, or a example of a case. I have chosen a simple case so that each one of us can easily relate this and discuss this interactively in this session. So may you can note the case and we can have the interactive discussion by end of the session. So this case was of Mrs. RYV, a 49-year-old female who entered my cabin seated in a wheelchair. So first time when she entered, she came on the wheelchair and she was quite weak, and she on looking at her, I could feel that this patient is coming with long standing suffering of chronic illnesses. And when her vitals were checked at when she entered, so her saturation was on and off, like it was 88, 89, sometimes 90. So it was fluctuating and she was gasping a bit, and her blood pressure was on lower side. And on looking at her, I could feel that exhausted picture. The exhaustion and depletion could be felt even after looking at her face. So this was the first initial picture of patient. Then we took a case, And then this case, going through her reports, we got to know that she was known case of rheumatoid arthritis. She had been diagnosed with systemic sclerosis, then interstitial lung disease, and this all conditions gradually what they did is they limited the mobility of patient and strength to perform her duties independently. So basically, this patient had been through the other treatments, other suppressions, and many of the disease, one after other, through the suppressions, and finally in this state front of us. So she also had history of gastric esophageal ulcers, which were treated for 5 years. Then she was a patient of thyroid disorder, and then she had suffered once with COVID, dengue, and then she took the COVID vaccinations after that. And overall, this case was entire burden on the vital force or the immune system of the patient. So whenever I looked at this picture of this patient's totality, there was entire haphazard symptoms, haphazard burdening on the vital force, and this was impossible to be cured unless and until it was cured with the right homeopathic medicine. So this quiet all sufferings of this patient, she had actually been prolongedly ill for so many years that she had been like given up. So when she met me first, she said, now I have left everything. I have left all the hopes. And the thing is that now this is the last chance I'm giving to my body and myself as the purpose of treatment, or I'm going to stop everything. So this face of her lacked expression, posture was very slumped, and entire presentation conveyed exhaustion in every form, exhaustion body level pay, exhaustion on emotional level, like she was completely exhausted with life. So this picture of patient told us nothing but this is your last chance. So we had to take this case as a last try on her. Okay. So her family history, her father had carcinoma of prostate and he had been expired, and mother had no significant illness. And her reports, as you can see, so in this reports, as you can see, uh, this RU52 antibodies were positive 2 plus, PCNA antibodies were borderline, ANCA anti-neutrophil cytoplasmic antibodies were weak positive. Then her HRCT, so it showed a typical viral infection, interstitial lung disease, CORADS 3, severity score of 10 by 25, moderate, multiple focal areas of airspace consolidation with ground glass opacities, interlobular and interstitial septal thickening. So basically her lungs were fibrosed. So lung pathology was that it was in the case of fibrosis, degeneration, uh, syphilitic stage. And her chest X-ray showed I saw the X-ray, which showed cardiomegaly. There was a tracheal shift towards the left side. Lymph nodes were enlarged. So now we'll start with the case. I hope everyone is getting, right? So everyone is getting the case, right? Yeah, give me your thumbs up if everyone is getting the case. So we can start with the complaints of patient. So complaints of patients were breathlessness, difficulty in breathing with chest congestion and wheezing, aggravation on deep breathing, bathing, exertion, ascending stairs, talking, coughing, amelioration on sitting, leaning backwards. Okay. So these were her ameliorating modalities. Then second chief complaint was cough with recurrent coryza, recurrent coughs and recurrent coryza. So there was profuse white and yellow expectorate, which was difficult to expel out, which she had to hawk out with force and drop it down, which was aggravated as soon as she lied down. She complained me that she couldn't lie down for months and months. She couldn't sleep because her cough was aggravated as soon as she touched down and she was lying down. After bathing, cold air, warm water, amelioration by warm room, sitting, night, and after expectoration. So, third complaint she had, which was multiple joint pains. So, pain and stiffness in hands, knees, shoulders, phalanges, and jaw joint. Even she could not, barely she could talk properly because her jaw joint, this joint was also, she couldn't move it. It was also stiff and painful, that she was talking also very slowly with very much exhaustion. Then she had pain in all joints of body with cramp-like pains, which were aggravated mostly due to cold, winter, morning time, ascending stairs, or the cloudy weather, amelioration with heat, pressure, rubbing, and summer. The fourth complaint which she had was systemic sclerosis feature. So, which was what? She, as I told you, she had difficulty in opening mouth. She told I couldn't open my mouth completely while eating. Also, I had to open my mouth very little, and then this was very gradual. She said first initially I could eat properly, talk properly, but slowly, this muscles of mine and joint became so stiff that I couldn't talk or open my mouth completely, and the skin of this face always feel stretched backward as if the skin is pulled backward. That pulling sensation was there, and dryness of the skin, reduced lip size, tongue got retracted, difficult to protrude tongue. As we say our patients to show their tongue while we ask for thirst, she could barely show her tongue out. Like she was, it was very difficult for her to open her mouth and show her tongue. So these are the some clinical features or characters which we observe while clinically we give the medicine to the patient. So fifth complaint which she complained of was the skin changes, that was skin rash. There was a blackish discoloration on her joints like fingers, hands, phalangeal joints. She had blackish discoloration. On her face also, right, she had a blackish dark discolorated face. And there were cracks and ulcers around the nails, which came and gone. These cracks were due to the excessive dryness of skin and uneven pigmentation. This usually aggravated in winter and rainy season, but presenting picture, she had all these complaints. So she had hyperacidity. So in hyperacidity, what she complained of was burning in esophagus on and off, which was aggravated with spicy and non-vegetarian food, and which was ameliorated by warm milk and cold water. So this was the sixth complaint. So now this all were chief complaints of the patient. As you could see, there are n number of multisystemic involvement in this patient. You'd see there are many complaints which are haphazard, which are not having link with each other, which are barely to be taken in consideration uh, while they go for any other or allopathic treatment. So these symptoms are all narration of different systemic involvements, different type of complex disease, which may be artificial, medicinally created disease and naturally result of suppression of natural disease, and this is basically a mixture of all. So here, as a homeopath, what we see to this case was to look on the presenting feature of the case. We always here, when we practice at such a massive level of homeopathy hospital, here what we take in consideration is importance to the pathology of patient. Pathology is nothing but the presenting symptoms of the case. So we try to take a character pathology. Character pathology means we focus mostly on the things other than the normal course of disease. That means we focus mostly on the presentation in case of a patient and modalities. So we mostly give most importance to these two things in first part of case. And other than that, when you go further now, as a classical method, we also ask for this personal history questions, which are diet mix, desire for sweet, 2 plus, non-veg, fish, meat, aversion to bitter, appetite good, hunger intolerant, thirst, small quantities, thirsty, tongue pink, white coated, difficulty in protruding, perspiration scanty, on chest, sometimes on back, forearms, hot sweating, sleeps for 7 hours, sound refreshing, covers head. But nowadays, her sleep was disturbed due to cough, but initially her sleep was this well. And dreams usually of water, well. And thermal reaction, thermally patient is chilly. So this is the personal history of patient. Female history, Minark was attained at right time, menses irregular, scanty, reddish black, no clots, back pain before menses. LMP, I have mentioned her. Leukoria, white, sticky, scanty. Obstetric history G4A2 L2. Now, after this, we move further to her mental and emotional symptoms, which were now and in childhood. So, when we take such chronic cases, it is very important to focus on both, right? So, how the patient landed in this situation and what was she before this? So, a person, there is a journey of disease. Likewise, there is a journey of person getting deranged. So this both the journeys are very much important to study. Why? Because in this similar way, we can assess the miasmatic tracing journey of the patient, and we can correlate it with the homeopathic medicine. So in childhood, this stayed separately, poor financial condition, good scholar, interested in studies, desire to study further, but her there was early marriage at 23, so hatred towards father, calm, playful, desired company. After marriage, arranged marriage at 23 years age gap of 3 years, financial responsibilities on both the partners, health issues in the family, so she had to take responsibility for that. In-laws health issue she had, so she had to be responsible for that. She had to work, she had to take care of those in-laws, and due to this responsibilities, she was always irritable on this, because she didn't wanted to, she wanted to study, she wanted to do something for herself. So this was her words. So presenting state now, presenting, she, when asked her about what do you feel right now, was anxiety about disease because of her long-standing sufferings, and some time in a while, there was death of her father due to prostate cancer, which she was disturbed because she had discords with him. And then there was death of his father, but that due to which her death sister also died because of that shock of father's death. But that grief wasn't very much very much impactful in this case, as she told. Yes, initially my relation with father was also bad, and so it didn't matter me much, but yes, I feel bad, I still remember my father, I feel sad for that. So here we took the word grief. So weeping disposition, anger suppressed, especially towards in-laws, because she had to take the responsibilities, and then her responsibilities which she took were not cared for. So she had anger, and which the anger was suppressed. She couldn't directly express them because they were not in condition, and she had to care for them. And her basic nature was calm, timid. She desired for company, and fear of poverty. Due to the financial burden, she always felt that she had fear of poverty, and she had to do something so that she could be financially stable. Presenting mental state also had the feeling of ambition loss because she wanted to be teacher, religious, cleanliness, one plus, punctual, industrious, duty bound. As I told you, she always thought of I should always keep doing something so I can be financially to certain stability. Consolation, amelioration, good relation with others. She was talkative. So this were the case details. Now I would like the session to be interactive. So you can just share me what do you feel in this case should be considered as the priority or should be considered first in the totality. So you can just drop the messages and you can just interact with me. Dr. Danish?
Yes,
Yes. So that
this
can be interactive, right?
yes,
So I
yes,
have shared the case and we can just discuss on
yes.
it.
Those who want to participate in discussion may please raise your hand, or those who want to have suggestion, you can either write
Yes,
in
ask
the
about the
chat
case.
box.
Yes.
You can write in the chat box. Otherwise, you can offer. You can just raise your hand so that we will allow you to unmute yourself and speak, and you can ask the question as well as your suggestions also. Anyway, a wonderful case.
Yes.
Let's see how it. And we used to say that the well-taken case is half cured, but this mode of case taking itself will definitely give the half relief to the patient.
Yes. It's very important. As you said, this sentence, well taken case is half cured. And in homeopathy, every case, acute, chronic, complex, or any, every case, thorough case taking is very important.
Yes, Dr. Jolie or Dr. Sheila, if anybody has any suggestion, please put forward your suggestion.
Down came the rain and washed the spider out. Up came the sun.
Pathology should be considered first in one suggestion.
Yes.
Dr.
Right.
Navla.
Yes.
And the
Pathology is considered
Respiratory
first.
complaints first by Dr.
Priority.
Sheila.
Mm.
taste past the night.
Yes.
I love for the dark night. So he writing over right
That's one another doctor's ailments from is more important.
Yes, ailments from, but this
Okay.
is a complex picture.
Yes.
So it's very difficult to find a single ailment.
One
Okay.
Okay.
Hmm.
Okay.
But good answer.
But doctor, this
Yes.
may be a phosphorus case, is it not?
We will discuss on the remedies. Yes, now on this topic, it's not very important what remedy is given to the patient. It's very important that how you approach in such cases, because the approach will decide what kind of results we get. So again,
The present mental state is more important, I think.
yes, right. Yes, I'm going through pathology should be considered first. That is right. Multiple sclerosis pathology should be considered. Right. Anyone, anything else? Disease progress and stage. Right. Okay. So, yes, disease progress and state, pathology, or the presenting symptoms. So, what this sums up under the one topic in homeopathy. What is that? What we consider? So all these answers you're giving me. So this sums up in one word. What is that called word? Any one of you? Yes, Dr. Tejraj, right. So miasm is that word. Dr. Mayur, right? Hmm. Miasm is that word. So everything what we discuss, this sums up in one word. That is miasm. Miasm is nothing but it is the journey and totality of the progress of pathology. So here, what we'll consider is surely we'll consider the miasm of the case. And what miasm do you feel this case is going through now?
A destructive miasm is going on. That's what we can see.
Yes. What miasm is this case?
It's a syphilitic miasm.
Yes, right. Dr. Namrata. Uh-huh. Yes, syphilitic. Yes, right. Someone else also. Yes. So this is a syphilitic miasm. So basically, there are some skin symptoms which you would see: skin dryness, itchy skin, discoloration, and there are entirely degeneration and syphilitic kind of symptoms. So what this tells us is there is two states. Now there is a pathology which is beginning in soric state and which has jumped up to the syphilitic pathology, and this transition is due to what? This transition is due to suppression. Hmm. So the suppression was at that level that the psoric pathologies have directly now turned into the syphilitic cases. So when such things happen, when does such a pattern can be seen? So can we discuss this? Any one of you doctors? So I'm getting very good answers from you. So that's very nice and interesting. So when do we see this pattern that a psoric case is directly seen showing the syphilitic presentations? So when does this happen? Any one of you? This is very interesting, right? This depth of study, this happens only in homeopathy. So we are very, very much lucky to study this science because this level of understanding of disease, this level of understanding of pathologies is only possible in homeopathy and only possible in classical homeopathy. So Dr. Hahnemann has been a genius who thought of such at such an extent that it is applicable till now, till the date after so many years. So, so it happens in which case? Example, common examples.
Here it is written as a tubercular miasm.
No,
And
tubercular not actually. In this case, there is a directly, you can see psoric symptoms some, and you directly see the syphilitic symptoms. Okay, so
Then
this
it is the scrofulous. Madam, it is a scrofulous diathesis.
Yes, diastasis is again a different part to be considered. But in this case, the question I was asking is suppression, right? Yes, this all is due to suppression. But I am saying the pattern or shift. See, mostly you'll see most of the cases go through this pattern, or what we learn is the. So we are calling this complex disease case. Okay, so the word complex here is due to this kind of confusing state. So, what we see is the miasm progresses from Sora. Then you're traditionally taught Sora will progress into psychosis, and then psychosis progresses down there to tubercular, and then syphilis, right? So, this was in natural diseases. जब natural diseases होती है, तो ये pattern is followed. But when nowadays, even if we take example of COVID, okay, COVID is a acute and subacute kind of a viral disease. But what happens is there are soric presentations. Some people recover to that soric presentation, and some of them which don't recover, they may land into the syphilitic complication. Recently, example of this kind of viral will give you a clear idea. What happens in this is the body susceptibility or the body immunity is at so much challenge. Immunity, nothing but the body vital force is at so much challenge that the vital force stops reacting and vital force suddenly collapses and jumps the miasm. Okay, and jumping miasm. And this jumps the miasm and it directly goes to the state of syphilis. So, Sora to syphilis. So, this kind of diseases, this kind of some artificially induced diseases or some kind of artificial suppression or some kind of medicinal suppression leads to this kind of miasmatic changes. Okay, so when you're seeing a normal case, there you won't find this. There you won't find this kind of transition. When you're seeing this level of case, where there is this level of suppression, either medicinal suppression or there is such a viral load to a vital force and immunity has to be dropped down. Vital force suddenly gives up. So there is this jump of miasm. Okay, so such cases they are called complex diseases because of this complex state of miasmatic reaction of vital force of patient. Okay, did you get it? Any doubt on this? Okay. So now we'll discuss now on the totality of case. Okay. So now you got what we'll consider importantly is we'll consider the miasm. Okay. So the remedy which we are giving should be completely covering the miasmatic state or pathology. Okay. Then now what we have to consider in totality priority is that we have to consider the characters now. So now we'll start picking up the characters. So what were the characters in our case? So quickly start typing in the chat. What were the symptoms which you thought that this was the character and this needs to be taken while considering the medicine?
And doctor, we have only 6 minutes more.
Okay, 6 minutes. Okay.
Okay.
I thought there is a time. Okay, I'll wind up. I'll try to wind up it quickly. Okay. So we can go, so we'll go directly on the totality. There are 6 minutes, so I want to show you other things. So in totality, what we'll take is dyspnea, cough delivering, rising from the ground, talking while sitting amelioration, joint pain, which is aggravated in winter, then cold water, sunlight amelioration, desire for sweet and meat, aversion for bitter food, cloudy weather aggravation. Her all symptoms mostly aggravated in cloudy weather. Ambition loss of ailments after financial loss. Timidity. So repertorial totality, basically what we took was mind anxiety about health and future, mind grief, weeping disposition, respiration, dyspnea on exertion, bathing and talking, extremities, joint stiffness, worse by cold, better by heat, skin was hard, tight, stiff, discolored, and ulcers. Generalities we considered was chilly patient, her all symptoms were worse by winter and cold, as we could see in the case, and everything was better by warmth. So this was the repertorial totality which I considered. So now directly we are going on to, because of we have a time frame. So you can directly pop up the remedies. So whoever wants to share the remedy analysis now, they can share remedies. So we can be quick, quite quick. Yes. So
Yes,
what we have got is
yes, you can write.
Kali carb. Okay, Hepar sulf. That's nice try. Okay, anyone else? Yes, you can quickly share your remedies, findings. Anyone else? Rust talks. Okay, okay, okay. That's nice. Other
Phosphorus.
than
Phosphorus.
phosphorus. Okay, phosphorus. Again, someone with bryonia. So here the patient is completely aggravated by chilly, cold weather, cloudy weather. So bryonia is exactly contradictory to all these symptoms. So bryonia can't come in any way. And Rustox again is a very superficially similar, but not completely covering the miasm. Again, the mental state of the patient. The Rustox not at all. Hepar sulf again, Hepar sulf, yes, but the vitality and the reactivity of the Hepar sulf patient is very much different. As in this case, it is very different. So in this case, the activity level of the patient is quite low. So Hepar sulf doesn't come there. Arsenic again. Arsenic, yes, it's a choice, but again, the irritability of arsenic is nowhere marked in this case. And the other thing, arsenic modalities are also not present actually in this case when you see the totality. And presentation also is not of arsenic. Anyone else? But good, everyone is sharing nice interpretation. But again, I'll say the remedies which I went through, what you're sharing, are actually all the remedies which are more of specific you're thinking on. So be broad, be in search of a constitutional remedy in such cases, because as I said you, such cases there should be importance to miasm, totality, basically a constitution. So if you give a right constitution, she'll heal for her life. So this is the thing, or even a single dose of that remedy will be a magic. Staphysagria, okay, that's nice one. Okay, that's nice one. Yes. That is a very good try, Staphysagria. Okay. So I've got a very good response with the remedies. So
Just 2 minutes remaining.
yes. I'm sharing the remedy slide. So this is the patient, okay? So the patient which was exhausted on wheelchair, you can see her face. You can see her smile.
Yes, we can see the smile.
Yes. So the remedy here is Sepia 30. Okay. So the remedy was simple. And the remedy was, I have the video of patient. Should I share it, or we
Yeah.
have a very less time?
Yeah, okay, you can share it.
we have a remedy reasoning left and everything. So the remedy which was given to a patient was sepia because of the autoimmune background. Okay, it's jumping. Autoimmune background with multi-system involvement, marked skin sclerosis with joint and lung pathology, strong mental picture of grief, suppressed emotions and anxiety, clear thermal modalities, and always a single well-selected remedy can create a wonders for it, right? So now I'll be sharing a short. I have multiple follow-ups of this
नाव
patient.
तुमचं
So this is the patient.
सुरुवातीला तुम्ही इथे आला तेव्हा काय त्रास होत होता तुम्हाला
खोकला खूप होता, दम लागत होता आणि छातीत कफ खूप साठलेला होता.
अजून काय त्रास जाणवत होता जेव्हा तुम्ही आलात तेव्हा
डोकं दुखत होतं
मग त्यानंतर
आणि जेवण जायला लागलं हळूहळू.
बरं.
Can give the
आणि
description
मॅम
in
बद्दल काय
English.
सांगताल
Yes,
मनस्वी
yes.
मॅमने
So,
तुम्हाला ट्रीटमेंट
so
दिली
this is the
त्याबद्दल
lady. So she had come in
छान
wheelchair, as I
दिसत
told you.
आणि असं
And the
व्यवस्थित
next
समजून
follow-up
सांगतात.
only,
कशी औषधं घ्यायची,
she
काय
was not
करायची.
hospitalized,
Mhm.
but she was asked to keep the follow-ups. So next follow-up, within 6 days, she came walking by herself. She came without this complaints, and basically, importantly, she was with improved appetite. Her breathlessness stopped. She could be walk properly, talk properly. So this was very drastic change. You can see, and this is with the single homeopathic remedy, simple 30 potency. Okay, so then on the mm, 3 months treatment, 4 months treatment, her repeated scans were done. Then her follow-ups were kept, and she was improving, and then she was stable finally. And now that patient is quite stable, and then we reduced her all the drugs which were given from allopathic this. So we gradually stopped all those medicines, and the patient was free from all this. So from this case, the summary is that yes, it's possible to cure in even such complex and deep pathologies through a simple treatment of homeopathic remedies with right knowledge. Okay,
Okay.
so here I would like to just conclude with a few things that while treating such kind of cases, what you need to be considered. Okay, so this is nothing what only I have seen. This is all mentioned in Organon of Medicine. So firstly, what we talked about is removing the maintaining cause. Removing the maintaining cause for now is stopping the suppressive drugs, which are ILD. There is a drug which is continuously going when the patient come to us. So firstly, we have to focus on how we can taper down that drug. Okay, and then or tapering down their other drugs which are steroid or methotrexate in cases of autoimmune disorders. So it's very important for focusing us on tapering down that doses. Then only the right action of homeopathic medicine can be seen. And then secondly, we have to correct their lifestyle, diet, and emotional stress triggers. So we have to guide patients on this also for such a quick result. Then secondly, we are not treating the patient nor the pathology, but pathology is the end result and not the disease itself. Okay. And thirdly, single and simple medicine. I have mentioned the aphorisms also. So as I told you, this is all principled and classical thing. So this all is mentioned. One remedy based on a totality with constitutional this can always cover such kind of complex diseases, and the totality should be considerate, and it should be considered at level of mental, physical, characteristic modalities, past history, and not only the diagnosis, not only the miasm, but it should cover the entire picture. And minimum dose again, that is of 30 potency. To start with the minimum dose, it is very important because it gets us to the real picture of the patient. Okay, and the remedy should be anti-miasmatic. So here again, sepia is a very good antisyphilitic remedy. And then again, don't try to rush. It is very important in complex diseases like this to wait and watch, allow single medicine to act, get the right picture of disease up, to not interfere or not repeat unnecessary, to observe the right direction of cure. In right direction of cure, what we mean is that it should be always within outward, above downward, more vital to less vital, and reverse of appearance. Okay, so even if temporary there is a homeopathic aggravation, you should wait and watch. And as you know, this question, why only homeopathic medicine can cure complex diseases? I truly believe that only homeopathy can cure such type of complex diseases. This is because we act on vital force. It is not limited to the pathology. Our medicines are not in limitation to the pathology. We address the root cause of the disease and it does not suppress at any level. And we use the law of similars, which is nothing but permanent restoration. So again, I end my session on this note. And I would
Thank you.
like, if anyone has any question, and you
Yeah.
can interact with me for last 1 minute maybe, and we can conclude. And
Okay.
thank you for having me here, for patiently interacting and discussing, and hope to see you more and discuss more, learn
Yes.
homeopathy along with you. Thank you, Dr. Danish. Thank you, sir.
Okay, thank you, Dr.
Yes,
Manasvi Manish Nikam. It was really an excellent session indeed, and we really enjoy the beauty of homeopathy, because that's the word I would like to add, because not
yes,
simply
yes, truly,
proving,
truly.
but really
Yes, yes, Doctor. Doctor Manasvi.
there was
Yes,
everything. There is everything in the presentation, and since there is no time, hope we can have some more presentation from you so that we can sit together, work together, and build homeopathy to take homeopathy to a greater height. And that's what
yes,
uh,
yes,
Dr. Amar Nigal sir is doing, and
yes,
you people are just simply doing the same with sir.
yes,
Congratulations to the
yes.
whole team from Aditya Homeopathy Clinic.
Thank you, sir. Thank you so much.
And thank you.
So I would like to add it on the end that we maybe I have the participants which are from all over maybe India and out of India. I would like every one of them to humbly and kindly, heartfully invite to our endeavor of homeopathy, a place where the homeopathy we simply do everything for homeopathy, and I would like to invite them to our hospital any day, anytime, to any of the homeopathic lovers all over the world.
Yes, yes, yes. Definitely, those who want to visit the home at Pimpri, Pune, you can contact me, and I shall share the number and everything so that you can directly contact, or I shall arrange the trip for you. Thank you,
Yes.
Dr. Nancy Nigam, and those who
Thank you, sir.
participate in the session. Thank you all. Good night. Tomorrow we will have a
Thank you.
session from Dr. Devangi Pandey, and she will be talking about uh, some medicines tomorrow. All of you will join tomorrow at the same time. Over to Dr. Shaji Kudia tomorrow at the Malayalam session. Thank you all. Good night.